So today we are going to start another new topic in clinical anatomy, that is varicose vein. So this is the last topic in lower limb. So most of the important topics are completed regarding clinical anatomy. So this is the important topic you can see in your clinic, varicose veins. Nowadays most of the people are suffering from varicose vein. So let's discuss what is varicose vein, anatomy of veins, mostly lower limb veins, and causes, symptoms, sign, clinical examination, how to do diagnosis, medical management, or we can call allopathic management, what they will do. And at the end, we will discuss electrohomeopathy treatment. So let's start the topic varicose vein. So varicose veins is also known as varicositis. Varicositis, inflammation of veins. Okay, inflammation or any disturbance occur in the veins, mostly in the lower limb veins. Okay, so what will happen? The veins in the lower limb. So basically, the veins are present in the lower limb of three types. Are of three types. So one are deep veins, one are superficial veins, and one are connected veins, or we will call perforated veins. Okay, so deep veins are present on in the muscle mostly. Okay, superficial level veins are present superficially. So both are connected, and deep vein will bring the blood back to the heart. Okay, superior vena cava, then heart. Okay, so what will happen? So characterized by subcutaneous dilated tortuous veins, typically 3 in diameter, most often affecting the lower extremities. So, what will happen? Mostly subcutaneous veins are affected, superficial mostly. Okay, in some cases, deep, in some cases, perforated, connected veins. What will happen? They will dilate and they'll will change. Tortosis means shape will change, and it is more than 3 diameter. Okay. So where it will affect? It affect in the lower limbs, legs. Okay, you can see this is the image of lower limb. So this is the normal vein. Okay, straight vein. Okay, you can see this is the perforated veins. Okay, this is the main vein, normal blood flow. You can see image. The veins shape is changed. Okay, shape is tortosus. Okay, means like snake, like it like this. Okay, so this is called damage or varicose vein, varicositis. Okay, you can see this. So what will happen in the veins? So basically we all know that veins are the blood, the veins which takes away blood from the body. Okay, they have deoxygenated blood or carbon dioxide in the blood. So those blood it will take away from the body to the heart. Okay, so this is the main aim of veins. Okay, it will take away the blood from the organ. Okay, so I already told you that there are superficial veins, there are deep veins. Both are connected with connecting veins. Okay, so you can see this is the venous system in the lower limb. Okay, it is starting from the toe. Okay, from the toe. So we have two large veins in the lower limb. We have two large veins in the lower limb. One is called great Cephanius vein. Great Cephanius vein. Great Cephanius vein. It take away from the blood from the lower limb. It is towards medial side, where it is present medial side, this side, toe side. Okay, toe. It is coming leg. Okay, and it is going behind the knee. It is here knee. It is behind the knee, and it is traveling towards the central of the thigh. It is merging with femoral vein. Okay, and you have another this is longer vein, this is shorter vein. So that's the reason we are calling small cephanius vein or short cephanius vein. Here also called large cephanius vein or great cephanius vein. It is going towards the posterior, anterior posterior to the ankle bone. So this is the ankle bone. It is going back from the ankle bone, posterior to the ankle bone, and it is traveling from the calf muscle. Okay, from the calf muscle, and it is going behind the knee, posterior to the knee, and it is merging with popliteal vein, merging with popliteal vein. And other, these veins are connected veins or they have deep veins. Okay, so this is great cephanius vein and small cephanius vein. So where will problem occurs? In this vein, the problem occurs. It may be from the femoral vein to the from femoral vein, from the starting point to the ending point of the leg, or at the small cephanius vein. Small cephanius vein. Okay. So we have superficial system. Okay, great cephanius and small cephanius. The deep system, we have femoral, popliteal, and tibial vein. Okay, from the popliteal vein it will become tibial vein. Okay, from the popliteal vein it will become tibial vein. That is the reason here we'll call it tibial vein. Okay, and perforating veins, there are the bridges, so like bridges like this. Okay, from the deep to the superficial. Okay, so what will happen in the veins? You have valves. What we have valves. Okay, another an image you can understood very easily. You can see this is the great cephanius which is starting. Okay, and you can see it having branches, anterior branch, posterior branch, and it is going towards the thigh region from the medial side of the thigh. Again, it is joined to the femoral vein, and he have two branches, anterior branch, posterior branch. Okay, anterior branch, posterior branch, and it is small cephanius vein. You can see it is going behind the or posterior to the ankle joint and going forward, and have it is merging with popliteal vein and have branches. It have branches. This is how the veins are seen in the lower limbs. You can see it is starting from the lower limbs, and you have arc. Here you have great cephanius vein, and you have here small cephanius vein, and in between you have the deep veins, and you have perforating veins. These are the perforating veins connecting from the deep to the superficial veins. Okay, you can see in this image, and I see I have another image. No. Okay, so this is the venous system, great and small cephanius vein, which collect the drainage system of the lower limbs. Okay, now the important part of the vein is valves. So what will happen in the veins? We have valves. Okay, what valves will do? Valves will protect the blood to come backward. Okay, if it goes forwarded, black valve is protected. What will happen to backflow of the blood? Backflow of the blood. Okay, if you see this image, okay, you can understood this. our veins have three layers. Okay. First layer is, you can see, tunica intima. Tunica intima. Second layer is basement membrane. And next is tunica media. And first is tunica adventitia. First layer is tunica adventitia. Next layer is tunica media center. And third layer is tunica intima. Tunica intima. And valve is connected to tunica intima. So what will happen? Okay. Here valve damage will occur. What will happen? Valve damage occurs. So valve damage occurs in the varicose vein. First thing happen. What will happen? Valve damage occurs. So valve damage occurs. So backflow of blood starting. So first step is backflow of blood starts when valve damage. So backflow of blood started. Then what will happen? Gradually, the blood will not flow back to the circulatory system. It will stay there. So what will happen? Gradually, the veins will become swell. Okay. So what will happen? Backflow will remains there. So what will happen? It will increase the pressure, gravity. Okay. So what will happen when calf muscle contract? The blood will go upwards, and again contracts. Again, blood will go forward. So already I told you that the calf muscle, gastrocnemius, and another muscle is also known as second heart of the body. Okay, because it will when they contract, the blood will go forward. Okay, so what will happen here? Valves damage occurs. Even though the muscle contracts, the blood will go forward, but some blood will remain in the blood vessels. So what will happen? We have gravitational force, means the body energy will remains lower side, most energy. So what will happen? The blood cells, plasma, and other things, whatever things are present in the blood, it will come to the downwards. Gradually, it will come to the lower end of the leg. Lower end of the leg. So wherever the problem is there, so which wall is affected? So you can see some sort of blood will present in the interstitial cell. Okay, in the muscle, in the veins itself, in the connecting veins. Okay, because of the pressure increases gradually. Okay, so here pressure increases. So you can see what will happen. So gradually backflow happens. What will happen? The blood remains in the veins. So what will happen? Pressure increases in the blood vessels. So what will happen? The fluid or blood cells will go into the interstitial fluid. Okay. Gradually interstitial fluid also filled with these types of cells. Then you will able to see the swelling. Okay. So here I have one question for you. Okay. So what is the how the exchanges of things happen, okay, from the blood vessel to the cell, okay, which is the protein. Here one protein is responsible, okay, to maintain the interstitial pressure. Okay, exchange of things happen, they know when only then the pressure is maintained. So can anyone tell what is the protein name? Okay, so arteries have blood pressure. Okay, blood pressure is there. So least pressure is 20 to 25 or 10 to 15. Okay, when the pressure 120 from the heart started, it gradually decreases 45, 40. Then when it reaches to the cell, the pressure is 10 to 15 mm per Hg. Okay, can anyone tell which is the protein is responsible for exchange of this things from the capillary to the cell, which is the protein. Because of that protein, the exchanges of things will not happen. Okay. So there's the reason most of the person having swelling in their legs, edema in the legs. So that protein is nothing but globulin, albumin and globulin. These proteins are responsible. Understood? So basically, come to the point.
Okay, sir.
So here, what will happen? The pressure increases, the water in the blood will go outside because of the pressure, constant pressure. Okay, because our cell membrane and veins are transparent. Okay, they are having uh, what will I will tell you. Okay, the term is not coming. Okay, so it will happen. It will exchange. Okay, because of the pressure, and the cell and the membrane is uh, having higher concentration to lower concentration. Okay, if the fluid is high here and the fluid is cell in less, so what will happen? The exchange of medium happen. This is the law. So wherever you have higher things, it will automatically come to the lower ends, like water, okay, like anything. So this is called higher concentration to lower concentration, like oxygen, carbon dioxide, everything. Our cell membrane have permeability. Okay, permeability. This term is I am missing. Permeability. Exchange of medium happen when higher concentration to lower concentration is there. If if only we have two things. If it is low polarization, like oxygen. Oxygen has low polarization, low uh, polarization in positiveness, and it is smaller molecule. Oxygen is low molecular weight. So that's the reason it will exchange easily. Water also same, low molecular weight, low polarity. Carbon dioxide is that they doesn't need energy, okay, to send the oxygen to bring back the carbon dioxide. Okay, we doesn't need energy. Little energy is affected for the lungs only. Okay, so it can easily go to the cell, and it is easily reverse from the cell itself because of low polarity and low molecular weight. So here also same thing happening because of fluid. Blood is not going out upward. So what will happen? The fluid and every cells is taking place in the interstitial fluid. Okay, what will happen? You will able to see the swelling. So what will happen? Due to that reason, smooth muscle hypertrophy happen. Muscular layer, whatever muscles are there, you can able to see the swelling around the veins. And gradually, if you are not treated, whatever cell is there, their collagen releases gradually. So what will happen? So here the collagen will start around the cell. Okay, and gradually what will happen? They come together, and the fiber and the collagen, everything will come together and will form some type of clot. So this is called deep vein thrombosis. So it is very dangerous. Okay, if the thrombosis will go into the blood backward, so what will call it will cause the uh, clot in the veins, and the blood will not come towards the heart. And what will happen? It will give more pressure to the heart. The patient will have different symptoms. So okay, so what will happen? Gradually the thrombus will form, the clot will form. Okay, now, so wherever the valve is damaged, so you will find those things around the valve. So we have you can see this image. Okay, not this image. Hmm. This image. Okay, So if the valve is damaged here, you can see the veins swelling and bluish color and pain and as well as itching, and sometimes you will able to see black color also. Why black color? Because of dead tissue. So from lot or a lot of many days the blood is there only. So what will happen? The cells are died. Because of that you will able to see the blackish color. Debris are there. Return is not happening. What will happen? Gradually it will convert into the ulcer. Okay, what will happen? Blackish color, from to that it will convert to the ulcer, and ulcer to the non-healing ulcer. So gradually the varicose vein started, and blackish color, and then to the ulcer, then to the non-healing ulcer, because of not flowing the blood backward to the veins. Okay, due to the failure of valves. So if the valve is failed here, so you will able to see the entire portion is affected. If you see here, from here to here, the entire portion is affected. So that is written here, okay, in this text. So you will able to see that area. So sphenofemoral junction, in this is present in the thigh region. So if entire, so their valve is affected, entire leg is affected. Okay, or sphenopopliteal junction is affected, means backward to the knee or posterior to the knee. At that junction, if valve is affected, you can able to see leg is affected, or below, in and around the medial malleolus or ankle joint. So you will able to see the leg part is affected. Okay, so according to that you will able to see. You can see this is the normal veins, and starting 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 stage of varicose vein. This is the spider veins, what we will call reticular veins or spider veins. Now started the second stage, varicose vein or venous nodules. Gradually the nodules are present, and this is gradually swelling is there. Here swelling is not there, you can see. Gradually swelling is there, and some sort of blackish color started. Okay, it is here also nodules plus swelling plus blackish color. This is the third stage. Okay, the patient having swelling, nodules, and blackish color, as well as skin issues, means that is ulcer, means this is fourth stage. Most of the veins are affected, so backflow is not doing proper well. So this condition is at fourth stage. This condition is at fourth stage. So what will happen? Patient will have pain, heavy pain, skin decolorization, and I told you that their deposit of nodules, mean they are fat deposited happen because of the dead cells, because of the dead cells, and ulceration is started. Okay, so this will happen gradually if not treated. Okay, how can you measure that? They're the spider veins. You can see 1 mm. Okay, spider veins started with 1 mm. You can able to see superficial, and it is are like web like spider web. Okay, we saw here. This is like spider web. Okay, you can see this is the first stage. And you can see reticular veins, they are for 1 mm to 3 mm. You can see it is bluish, blue to greenish color. And now truncal varicose vein, it is more than 3 mm. Now nodules are present. Okay, now nodules are present. Okay, then afterwards started third stage and fourth stage, where ulcer, non-healing ulcer is started. Discoloration of skin will happen. Okay, so these are the normal veins, these are the varicose veins. So what are the reasons? Cause. Okay, first is unknown cause. Okay, unknown cause. There is no reason. for happening varicose vein. Okay. Or second cause is aging. Okay. Due to the older, what will happen? The valves become weak. Like other organs will become weak, the valves will become also weak. So this will cause the backflow of fluid. Then gradually, these things will happen. Or female, okay, hormonal changes happen during pregnancy or premenstruation or menopause. This will trigger the female hormone, which will relax the veins of the wall, relax the walls of the vein. Means it will relax the walls of the veins, means the valve will become fragile, means loose. Okay. Due to that reason also, varicose vein happens. Female in pregnancy, most of the pregnant women will experience varicose veins during the pregnancy because of the pressure. Okay. During pregnancy, the volume of blood your body increases to support the growing fetus. This produces more blood to carry to the rest of your body, but it also produces an unfortunate side effect: enlarged veins in your leg. Okay. What will happen? The veins pressure increases, the valves become fragile, loose, and backflow of blood will happen. And some family history, due to that reason also, obesity is one of the major cause of varicose veins because of pressure on the legs. Or mm, this is also one of the main reason: prolonged standing. Okay, prolonged standing and prolonged sitting, same things. What will happen? The blood flow, what will happen in the legs increases, gravity increases, gravity pushes the blood back to the leg. And what will happen? Valves want to flow the blood back to the heart, so it will fight between gravity and valves. So what will happen? Gradually the valves become fragile. Okay. So these are the reasons behind the mm, varicose veins. And sometimes you can also grade it: C0, C1, C2, C3, C4, C5, C6. Okay. So this is the new system in the chronic venous disease SEEP system. It is international standard. Okay. You can also, according to the stage, you can see more than 3 mm, C2, edema is there, C3, pulp, skin changes, C4, healing ulcer, C5, non-healing ulcer, C6. So it is grading system of varicose veins. Nowadays, it's running in the international standards. Now, sign and symptoms. What are the visible sign? What you are able to see? You can see skin changes and irritation. Okay, bulging veins, nodules, throbbing pain, pricking pain, sores, itching, and swelling. These are the common symptoms of varicose vein. You have to examine the patient. Okay. And you have to explain the risk of varicose veins also. Of course, there is a chance of thrombosis also. And you need to do palpitation and everything you have to do, whatever we studied. Okay. Ulcer is there, color changes happen or not, nodules are there or not. Okay, these are the things you have to do. Palpitation is very, very important. You have to palpate both Cephalus vein. You have to examine whole Cephalus vein. It may be large or small, great or small. Both you have to examine. Now you have to do some examination. You can see this image. This is the you are tying. You are checking the small Cephalus vein or great Cephalus vein. You are tying this. Okay. After tying, if anything is not visible, means it's negative. You have to tie at above the grades, above the uh, knee. Okay. You have to tie this. Okay. Like this. And if you see any veins are there, means it is positive. Okay. After tying, the visibility is increases gradually, means double positive. Okay. After tying, what will happen? if it is visible and after losing also it is visible, means it's negative. So you have to see the tortoise veins. Tortoise vein, it is very important. Tortoise vein is very, very important. Okay, like this. If you veins are visible like this, means positive. If veins are not visible like this, it's negative. Okay. So you have another test also. You can tie here, tie here, and tie here. Okay. You have to visible that area with the veins. If visible is there and visible is like tortoise, means like that it is positive. Okay. Okay. And understanding. And here, SF junction. Okay. Cephalus and femoral junction. Okay. What will happen? You tied here. Okay. After that, or you kept your thumb there and advise the patient to stand. Okay. For some time. Okay. If the veins are visible like this, okay, means tourniquet is applied. Here, tied any rubber band, any tourniquet, any tight rubber. Okay. And tell the person to stand. And after some time, release the tourniquet. What will happen? The veins are visible. Veins are visible. So, veins are visible, but like this in the wave form, it means they are the varicose veins. There are other tests also. It is enough to understand to varicose vein. You can able to see here Trendelenburg test, Perth test, okay, standing test, squat test, Doppler ultrasound is okay. Next, the scans. What are the scans required to treat the varicose vein? One is golden standard is duplex ultrasonography. Ultrasonography is the important test to do lower limb color Doppler of veins. Lower limb venous color Doppler. What is the test name? Lower limb color venous Doppler. This give the idea of the varicose vein, where the veins are affected. Everything you will get in detail. This is the correct diagnosis according to radiology. Okay. Then you have to treat according to the cause. Okay. So what are the conservative management? Leg elevation is important. So always tell the patient to keep the leg elevated like this. Okay, whole leg with the help of pillow or any strong thing. Or nowadays compression therapy is there. Stockings are advised to give the pressure to the veins to support the veins. Okay. And lifestyle modification is important. If I is always standing, take advice to them, advise him to not to stand continuously or not to sit continuously. Take gaps. Okay, 10 minutes, 5 minutes gap every 30 minutes and or every 1 hour. Okay. Prolonged wait, prolonged walking is not advisable. Okay. And advise to quit the smoking also. Okay, for better health or anything which is not healthy, we have to advise the patient to quit that. Okay. And in allopathy there are minimal invasive interventions also there, like example laser ablation, radiofrequency ablation. They will do surgery, minimal surgery. Okay. Or else surgical procedures also is there. Ambulatory phlebectomy. Okay, this will remove small or bulging veins. They will remove the small veins. Okay. And according to their protocol, they will follow and they will treat. Sometimes laser surgery is most common by or sometimes valve replacement also will done if the valves are completely damaged. According to their protocol, they will follow that. Okay, so this is all about varicose vein. I hope you understood. Our electrohomeopathy treatment. So I have always tell you this treatment is not final. According to the cause, according to the diagnosis, which inner organ is weak, So you have to treat that also. Lymphatic organ or sanguine organ, which organ is affected? So I believe that veins are connected with spleen. Veins are veins and arteries are connected with spleen and stomach. Most importantly, so whoever having stomach and spleen low function, okay, means their veins are affected. They will have umbilical hernia also. Hernia also one of the cause due to the spleen and stomach deficiency. So this treatment is according to this condition you have to add up on. Okay. So this is all about varicose vein. I hope you understood this. S5 A3 alternately A2 BE. Okay, start with A2, then convert to A3. C1 N1 YE, C1 C5 N1 G. G is very important. F1 A3 RE, C1 S10 WE, S10 A2 RE, and F2 A2 BE, alternately GE application, REYE hot compress. And one salt will come to you, that is Epsom salt, which is helpful for swelling and pain. You have to advise to take 1 spoon in 1 bucket of water in hot water and keep their legs for half an hour. Okay. So this is all about in today's class.